Thank you. I now turn to Mr. Sablan.
Thank you very much. Good morning to all our witnesses. Madam Chair, thank you very much for this series of hearings on issues that I hope will lead to a robust Higher Education Act reauthorization, but particularly today's hearing on minority-serving institutions is important to me. I, as chair of the other education subcommittee, I was always, it broke my heart, and some of the failures of programs under the Bureau of Indian Education for early childhood, K to 12. But Dr. Boham, today your testimony gives me some hope, and I really would like, your testimony states that your college and Oglala Lakota College co-led the nation in preparing and graduating Native American nurses, with more than 90% of your graduates certified as registered nurses and working in local community settings. You also testified that before Oglala Lakota College, or OLC, launched its nursing program, none of the nurses employed by the Indian Health Service to work on the Pine Ridge Reservation in South Dakota were Native. Of the 70 nurses working on the reservation in 2013, 80% were OLC graduates. Congratulations. What can small community colleges like the one I have in the Marianas in my district, what can these colleges with health workforce shortages and high indigenous population learn from Salish Kootenai College success?
Thank you for that question. Part of what we do really well in our nursing program is we create culturally competent healthcare. So we are caring for our own. And you have heard from other witnesses that our communities value, and one of their primary motivators is the opportunity to give back into the community. And I think our nursing programs exemplify that need and concern and wish to give back. Part of what we also do around our nursing program, and we have implemented it college-wide, but particularly in our nursing program where students have high stress, demanding academic requirements and clinical requirements as well, we provide wraparound services as well. So we have early alert systems, and if students are beginning to show stress or look like they might be faltering, the early alert system is accessible from our custodial staff to me. And if we see a student that maybe we're used to seeing every day and we haven't seen them for a day, or they miss a class, we have an electronic system where an actual person goes then to find this individual and make sure everything's okay. And if there are issues, we connect them to services and resources. We know that because nursing is the kind of demanding program it is, that it's really important to have preschool services available for women and young men who are primary caregivers to their children. But I think overall, the big thing is that culturally competent, culturally congruent care. We want to take care of our own.
Dr. Boham, again, you're provided a ray of light. I mean, that it's possible to break this chain in Native or in Native American schools, and I am encouraged. My time is up, so I will submit other questions for the other witnesses, but congratulations is not a word I would use, because this is a small step, but I hope it goes not just with your program, but also to other places in our country, like the Northern Marianas, where we have a small community college, and we have a huge need for workforce investment. Madam Chair, thank you very much for today's hearing, and I yield back.
Thank you, Mr. Watkins.